Hi, my name is Kyler Klein, and this is my Psych in film presentation. The film that I chose was American Sniper. So this movie is based on a true story that follows the life and military career of Navy SEAL Chris Kyle. The main character is Chris Kyle, who was a Navy SEAL from 1999 to 2009, who took multiple deployments to Iraq and became known as one of the most lethal snipers in American history. The setting of this film is majority in Iraq while Chris Kyle is on tour, but it also includes him back home and him after he retired, settling in the United States. His diagnosis is post-traumatic stress disorder. According to the DSM-5, this is a mental health disorder caused by experiencing or witnessing trauma marked by intrusive memories, avoidance, negative mood changes, and heightened arousal lasting over a month and impairing daily life. First question is, how could this film's cultural context impact the diagnosis? Well, since Chris Kyle is an American and he would be going to a psychologist in America, and since the psychologist in America refer to the DSM-5, he would be diagnosed with post-traumatic stress disorder. Do you think this disorder is diagnosed in all cultures? No. PTSD is not universally diagnosed due to cultural differences in recognizing and interpreting trauma. Some cultures may attribute trauma responses to spiritual issues or personal weaknesses and may lack formal diagnostic frameworks. Third question is, what stigmas are associated with this disorder in our culture? PTSD is stigmatized as a sign of weakness or unpredictability, with veterans facing stereotypes that can deter them from seeking help. I bring up the paper, Brian Davis's 2019 paper, The Cultural Context of Trauma Recovery, in which he says cultural competent trauma care and adapting evidence-based treatments to diverse cultural values are essential for effective intervention. Next is evidence. Two symptoms that were present are dissociative reactions and irritable behavior. So the example of dissociative reactions, like aka flashbacks, is in one scene he's sitting on his couch and he's just zoning out, and he can hear gunshots and wartime experiences, and he's kind of reliving that. Example of irritable behavior is he almost beat his dog, who was playing with his son. So his son his dog pushed over his son and was kind of playing with him, and then he went and grabbed the dog and almost beat him in front of everybody at a backyard barbecue. One symptom that was not present is the inability to remember an important aspect of the traumatic event. And a paper to go along with this is a paper published by the Journal of Social Psychiatry and Psychiatric Epidemiology, titled Assessing the Structure and Meaningfulness of the Dissociative Subtypes of PTSD. So this paper, along with the DSM-5, show that dissociative reactions and irritable behavior are symptoms of PTSD. Treatment: I would treat Chris Kyle's PTSD with cognitive behavioral therapy. I do think this is appropriate because scientific research affirms that it works. Particularly a study published by Dove Medical Press titled Cognitive Behavioral Therapy for Treatment of Post-Traumatic Stress Disorder. One concern would be prolonged exposure or recounting the trauma, and it might re-traumatize the patient or cause emotional distress beyond what they can tolerate. And social barriers that might hinder the character from receiving proper treatment is in military personnel being stoic and not wanting to receive treatment because they think it is weak. Broader perspectives. Is PTSD accurately portrayed in film? Yes. And how does the portrayal of disorders in film influence our understanding of these disorders? It helps us understand that even the best soldiers struggle with PTSD, and it's okay to seek treatment. Here are my citations.